Namaskar दोस्तों, I am Purnima from Fertility Dost. Good evening and welcome to yet another interesting session with Fertility Dost. Thank you UNS for arranging this session. This is really special because we need to talk about 35. The number is 35, we know that. और बहुत सारे issues, बहुत सारे doubts, बहुत सारी queries हमारे दिमाग में आनी शुरू हो जाती हैं when we just touch the 40. सॉरी 30. तो ऐसा क्या है 35 में कि हम घबरा जाते हैं? इज इट रियली सो दैट आर ओवरीज स्टार्ट एजिंग आफ्टर 35 और इज इट रियली सो कि हमारा थोड़ा स्ट्रेस लेवल बढ़ जाता है? एंड इफ यू आर इन योर लेट 30s तब तो लगता है कि शायद फर्टिलिटी कॉम्प्लिकेशंस आने वाले हैं, बट इज इट रियली सो कि 32 33 के बाद इफ यू आर प्लानिंग फॉर अ फैमिली दैट मीन्स आपके लिए ऑप्शन आईवीएफ ही बचता है? ऐसा बिल्कुल नहीं है. नेचुरल कंसेप्शन इज पॉसिबल. इट्स ओनली दैट कि वी नीड टू डायग्नोज द थिंग्स. हमें पता करना है कि आपके कंसेप्शन में डिले क्यों हो रहा है, और अगर डिले हो रहा है उन रीजंस को डायग्नोज करके वी रियली नीड टू वर्क टुवर्ड्स इट. और ऐसा बिल्कुल नहीं है. इट्स वी कैन से दैट इट्स अ क्लियर मिथ दैट अगर आप 35 के हो गए द ओनली ऑप्शन कंसेप्शन ऑप्शन इज आईवीएफ. इट्स नॉट दैट. सो चलिए आज हम इसी बारे में बात करेंगे कि इफ यू आर प्लानिंग कंसेप्शन at 35 or after 35 and what could be the possibilities for you. Is egg freezing is really a good option? अगर है तो how can you achieve this option? आप कैसे क्या क्या जानकारी है या कहिए कि कौन से ऐसे इंपॉर्टेंट फैक्ट्स हैं जो एक फ्रीजिंग से जुड़े हुए हैं एंड यस प्लानिंग कंसेप्शन एट 35. For this, let me call a very senior doctor to the main screen. The doctor is from Delhi NCR Gurgaon. So viewers, please start pouring your questions. और हमारा ये लाइव हमारे फेसबुक पेज पे, हमारे ग्रुप पे और हमारे यूट्यूब चैनल पे भी है. तो अगर आप फेसबुक पे नहीं हैं सो डोंट वरी, आप यूट्यूब के थ्रू हमारा प्रोग्राम देखिए एंड प्लीज डू आस्क योर क्वेरीज रिलेटेड टू 35. नमस्कार डॉक्टर गुंजन, वेलकम टू फर्टिलिटी दोस्त.
Thank you so much.
So viewers, we have very senior doctor from Gurgaon today with us, Dr. Gunjan Sabherwal. Dr. Gunjan is IVF specialist at Nova IVF Gurgaon and she has more than 23 years of experience. She has solved many complicated cases. She has given that beautiful smile on the faces of couples who really are seeking the help in this fertility journey. तो अगर आप गुड़गांव में हैं, दिल्ली में हैं या उसके आसपास हैं और आपको लगता है कि आपको मदद की जरूरत है तो प्लीज डू विजिट डॉक्टर गुंजन सभरवाल एट नोवा आईवीएफ. So, doctor, let's start with the main topic, conception planning at 35. Is it really possible? और अगर possible है तो क्या सच में IVF ही option है?
Thank you first of all, Purnima, for a very kind introduction. And to answer your first question, 35 के ऊपर definitely conception possible है. It can be natural and it may be assisted. But what is important is that हमें ये पता होना चाहिए कि कुदरती तौर पे जैसे ईश्वर ने मेल और फीमेल को अलग बनाया है उसी तरीके से उनकी रिप्रोडक्टिव पोटेंशियल भी फर्क होती है. तो जैसे कि हम देखते हैं कि फीमेल्स की रिप्रोडक्टिव पोटेंशियल जो है संतान पैदा करने के लिए वो जैसे जैसे एज बढ़ती है वैसे वैसे घटती है. और ये हम खास तौर से देखते हैं कि 35 एंड अप बियॉन्ड जो एज ग्रुप्स हैं उसमें फर्टिलिटी बहुत एक्यूटली डिक्रीज करती है. तो इसलिए हमारे पास समय की थोड़ी सी कमी होती है और प्लानिंग हमारी उस हिसाब से होनी चाहिए कि हम जल्दी अचीव कर जाएं. बिकॉज 40 इयर्स के ऊपर प्रेगनेंसी होना विदाउट असिस्टेंस इज आजकल के टाइम पे इज क्वाइट अ रेयरिटी. सो हेंस बियॉन्ड 35 वी कैन कंसीव नेचुरली बट we may require assistance and for that we should not hesitate to take help.
Right. And it's always not that कि अगर आप कोई फर्टिलिटी क्लिनिक सेंटर या डॉक्टर के पास विजिट कर रहे हैं, तो दैट मीन्स entering that gate means yes, you are the candidate for IVF. It's not that. It's just that कि diagnose important है.
Yes.
So, डॉक्टर गुंजन, आजकल हम डरते हैं लो वैल्यूज ऑफ AMH, and along with that we don't talk about AFC. So with age हमें पता है AMH लो आ रहा है, but what is the importance of AMH and AFC when we are just touching the 35 or we have crossed this 35 parameter?
देखिए, जहां तक सवाल आता है AFC और AMH का, तो उसकी जो महत्व है वो ये है कि वो हमें ओवेरियन रिजर्व के बारे में बताता है। और ओवेरियन रिजर्व बेसिकली हमें ये बताता है कि हमारी कितनी क्षमता है एग्स बनाने की एज अ वुमन. So basically no factor in should be assessed individually. The most important two parameters to assess the ovarian reserve are basically the female age, the antral follicle count on the second day of periods, which is the antral for AFC, and the AMH. So in तीनों को ही अगर हम इकट्ठा देखें, only when we correlate them, then can we say कि इस patient का ओवेरियन रिजर्व कम है या एडिक्वेट है या ज्यादा है. सो 35 के बियॉन्ड नॉर्मली भी हम देखते हैं कि AMH की वैल्यू फिजियोलॉजिकली ही कम होती है. बट आजकल के टाइम पे विद सो मच ऑफ pollution, so much of radiation and so many other factors, we are also finding that the AMH is decreasing much faster and at a very young age हमारे को low AMH मिलते हैं. इसको जब हम कोरिलेट करते हैं एंट्रल फॉलिकल काउंट से और एज से, तभी हम आगे अपनी प्लानिंग कर पाते हैं टू सी कि हमें किस तरीके से असिस्टेंस देने की जरूरत है. सो समटाइम्स वी फाइंड दैट AMH हमारे पास एक यंग लड़की में बहुत कम मिलता है, पर एंट्रल फॉलिकल्स हमारे काउंट फिर भी हमें दिख जाता है. तो पॉसिबिलिटी ऑफ अचीविंग अ प्रेगनेंसी आर ब्राइटर वर्सेस जब हमारे 35 के ऊपर हमारा AMH भी कम है और हमारा एंट्रल फॉलिकल काउंट भी कम है. तो ये सारी चीजें कोरिलेट करके ही हमें आगे डिसाइड करना होता है कि हाउ डू वी नीड टू हेल्प द कपल टू अचीव अ प्रेगनेंसी.
एंड डॉक्टर गुंजन, इट्स अ वेरी कॉमन वन लाइनर थिंग जो कि सब लोग कहते हैं, वी ओनली नीड वन हेल्दी एग टू अचीव प्रेगनेंसी. बट वो वन हेल्दी एग आफ्टर 35 के बाद क्या सच में मिलना बंद हो जाता है?
नहीं, ऐसा नहीं है कि बंद हो जाता है, पर प्रोपोर्शन ऑफ एग्स जो हमें चाहिए टू हैव वन हेल्दी एग, वो ज्यादा हमारे ज्यादा हो जाते हैं. लाइक इट इज सीन दैट जब आप लेस देन 35 होते हैं, तो एटलीस्ट 7 to 10 एग्स हमें चाहिए होते हैं टू अचीव वन हेल्दी एग. When you're in the age group of 37 to 39, you need at least 20 eggs. And when you are beyond the age of 40, 40 to 42, you need at least 30. And beyond the age of 43, you need at least 60 eggs for one egg to be normal. So you can assess that as the woman is aging, the proportion of normal healthy eggs is also decreasing. It is not that we don't have healthy eggs, but the proportion is much less. Hence, there is the difficulty in achieving pregnancy naturally.
So we can say that yes, age does matter when you are planning family.
Yes. It is the one only factor which is irreversible, which cannot be altered by any treatment. So hence, we have to keep that in mind when we are considering pregnancy.
And obviously, if you are facing any challenges or difficulties, then please don't hesitate to visit the doctor at right time.
Yes.
डॉक्टर गुंजन, हमने रिसेंट कुछ टाइम पीरियड में वी कैन से दैट इन अ ईयर और सो एग फ्रीजिंग के बारे में हम बहुत सुन रहे हैं. इवन मेनी ऑफ बॉलीवुड सेलिब्रिटीज, या यूं कहिए कि एक कॉमन है कि लोग सामने निकल के आ रहे हैं, दे जस्ट डिस्क्लोजिंग द फैक्ट कि हाँ भाई हमने एग फ्रीज करवा दिए थे एट वेरी यंग एज एंड नाउ we are capable of having a healthy pregnancy with our own eggs. So बहुत सारे सवाल, बहुत सारी क्वेरीज इससे रिलेटेड हैं कि अगर हमने अर्ली 30s में एग फ्रीज करवा दिया एंड वी आर प्लानिंग टू हैव प्रेगनेंसी इन 40s, तो इज इट रियली पॉसिबल टू अचीव दिस?
Yes, that is absolutely possible, and it is a very nice option these days, which is available, because now from basically now this is not an experimental strategy; it is an established standard practice, which is offered by most of the good IVF clinics. So basically, हम देखते हैं कि egg freezing की indications क्या है कि जैसे कि हमने देखा कि आजकल गर्ल्स आल्सो वांट टू कंसंट्रेट ऑन देयर करियर्स एंड द वेरी इंपॉर्टेंट फैक्ट दैट देयर इज अ बायोलॉजिकल क्लॉक व्हिच इज टिकिंग, तो वी हैव टू हैव अ बैलेंस बिटवीन career option as well as family options. So it is a very very prudent step by the women to freeze their eggs. Secondly, there are some indications जैसे कि बिफोर स्टार्टिंग कीमोथेरेपी या रेडियोथेरेपी जो कैंसर पेशेंट्स होते हैं, यंग कैंसर पेशेंट्स, उनको दे हैव द अपॉर्चुनिटी टू फ्रीज देयर ओन eggs so that they can aspire for and maybe think about their own biological child later on when their treatment is over. Thirdly,
Right.
not a very very well-known indication in India, but women who are going through gender change, उनके लिए भी एक प्रोविजन होता है टू फ्रीज देयर एग्स एंड look for their own genetic child. Then there are certain professions like maybe the Air Force and other professions where you can have a very fast depletion of your own eggs. तो उनको भी advise किया जाता है to freeze their eggs in time, because definitely once you're established in your career, when you are stable with your family, then you want to expand it. So this is a very good option which is available these days, and it has also refined over the times, because धीरे धीरे जैसे कि हमारी फ्रीजिंग टेक्निक्स इंप्रूव हो रही हैं, हमारे एम्ब्रियोलॉजिस्ट का एक्सपीरियंस बेटर हो रहा है, सो हमारी एक फ्रीजिंग टेक्निक एंड थ्रॉइंग टेक्निक्स भी बहुत इम्प्रूव हो गई हैं. एंड दैट इज वाई आपने सुना होगा कि बहुत सारे सेलिब्रिटीज दे आर कमिंग आउट एंड टेलिंग कि उनकी एग फ्रीजिंग की वजह से दे कुड अचीव प्रेगनेंसीज विद their own genetic babies basically.
Right. And Dr. Gunjan, what about the cost factor? मतलब एक common man के लिए is it possible to
जी.
go for egg freezing?
Well, definitely there is a cost involved with it, because as I was saying कि the number of eggs हमारे को जो जैसे जैसे हमारी एज बढ़ती है उसी प्रकार से हमें नंबर ऑफ एग्स की ज्यादा आवश्यकता होती है. और अगर हम देखें कि मिनिमम अगर हम लेस देन 35 हैं तो 10 to 20 एग्स तो हमें फ्रीज करने की जरूरत होती है, जिसकी वजह से अगर आप एक साइकिल में लकी हैं and you're able to get that many eggs, so yes, of course, one cycle is enough, or sometimes maybe 2 cycles or maybe 3 cycles may be required to freeze an adequate number of eggs. So normally one cycle of an IVF may cost something of the tune of 1.5 and above, but depending on how many number of cycles you have to undergo, आपकी cost उस हिसाब से बढ़ जाती है.
Okay, understood. So depending upon the number of cycles, stimulation cycles, the
Yes.
cost will be there.
Yes.
And Dr. Gunjan, for how many years we can freeze our eggs? Like कुछ ऐसा particular time है?
नहीं, तो अभी तक अभी ऐसी कोई रेगुलेशंस नहीं आई हैं एज पर द नंबर ऑफ इयर्स, बट डेफिनेटली फॉर 10 years तो है ही. बट वंस द एग्स आर फ्रोजन, दे कैन बी फ्रोजन फॉर एज लॉन्ग, बिकॉज दे आर नॉट सब्जेक्टेड टू टेम्परेचर चेंजेस, तो इस वजह से उनकी क्वालिटी में चेंज होने की कोई पॉसिबिलिटी नहीं होती है. सो वट एवर इज फ्रोजन इन द स्टार्ट कैन बी फ्रोजन फॉर अ लॉन्ग टाइम.
Okay, so in the beginning, if we opt for 10 years option, so again we can just renew that for
Yes.
another 10 years. Okay.
Yes.
But again, cost factor of freezing,
Yes,
we can.
there is definitely a annual renewal charge which varies from clinic to clinic. So, but that is much lesser than the actual stimulation charge. So basically, this is like an insurance, fertility insurance, we are kind of looking at, you know.
Right. And another is what about embryo freezing? So people are usually saying, okay, let's do embryo freezing because it is much more better option than egg freezing. But what you suggest and what categories of people really need egg freezing or embryo freezing?
Okay, so definitely embryo freezing is a much better technique because embryos are much hardy and they can take the stress of freezing and thawing better than the eggs, right? But for embryos to form, we need the sperms as well. So, a young girl who doesn't have a stable relationship or is looking at fertility preservation is not likely to have an embryo for her. So, for her, the option is egg freezing. But definitely, if you have a partner, if you're married, then and you're looking at fertility preservation, embryo any day is a much better option than egg freezing.
Okay, understood. Right. So next time, if you are thinking of freezing option, then as Dr. Gunjan suggested, please take care of this fact also, ki whether you want to go ahead with egg freezing or embryo freezing, and definitely if you are with your partner, then embryo freezing is the better option for you. Dr. Gunjan, if we talk about embryo freezing, so like कितने नंबर ऑफ एग्स या कितने नंबर ऑफ एम्ब्रियोज हैं जो आप एक पर्टिकुलर कपल को बोलते हैं कि यस दिस इज द गुड नंबर वी कैन डू फ्रीजिंग लाइक 2 3 4 5 कितना एडिक्वेट नंबर आपको लगता है होना चाहिए?
देखिए embryos का adequate number we cannot suggest because it depends on how many eggs and what is the potential of the embryo. In the sense, if there is no male factor, definitely as many embryos we can get is good. But it is more so regarding the number of eggs when we are doing egg freezing, because that
Right.
only ensures ki what is the possibility of us having a live birth from that. So, as I have already mentioned, that when the woman is less than 35 years, 7 to 10 eggs is what we are looking at. If she is from the age group of 36 to 39 years, we are looking at around 20 eggs. If she is more than 39 and up to 42, we are looking at 30 eggs. And if she is beyond 43 years of age, then we have to look at a much larger number, which may be like 50 to 60 eggs. So it is basically the eggs which we are looking at. Embryo, once we talk about embryo, the male factor also comes into play. So
Right.
for that, we cannot basically say that this is the ideal number of embryos that we have. So
Right.
it's like more the merrier, more number is better, of course.
Right, so that we can have better chances of conception
Yes,
with them.
yes.
Dr. Gunjan, many factors are also related to age. So when the advancement in age is there, we see that thyroid का फैक्टर आने लगता है कई केसेस में, इंसुलिन रेजिस्टेंट है, डायबिटीज है, हाइपरटेंशन है। तो अगर हम इन सब चीजों को लेके चलें तो क्या ये सच में एक थ्रेटनिंग फैक्टर है व्हेन वी टच 35?
Yes, uh, yes, if it is uncontrolled, these are important factors to be considered. One, because definitely our treatment has to wait till we stabilize these factors. Secondly, they also impact the gamete health in the sense the quality of eggs and the number of eggs will also be affected. And thirdly, if the person becomes pregnant, then you could be having additional medical illnesses along with the stress of pregnancy. So that needs special care again. So definitely having all these factors stabilized, like having a normal blood pressure, a normal thyroid, definitely not having insulin resistance. These are things which are going to help us through the journey of pregnancy. So in conceiving, in carrying, and also in delivering. So definitely it will be like a healthy mother giving birth to a healthy baby. And if
Health.
we have these problems, then of course they have to be tackled because for maternal health, it is important that we first stabilize and then we look at pregnancy. So that way we are even delaying pregnancy further.
Okay, understood. Right. Dr. Gunjan, as we just discussed about thyroid, तो बहुत लोगों का मानना है कि थायराइड के साथ अगर थायराइड हाई है, आपके इश्यूज हैं, तो प्रेगनेंसी होना डिफिकल्ट है. तो थायराइड ऐसा क्या करता है कि प्रेगनेंसी में डिफिकल्टी आती है?
So in one way, thyroid, all these hormones are, they affect the hypothalamic pituitary ovarian axis, and basically they directly or indirectly, they cause an impact on the quality of the eggs. So what happens with thyroid is that either the ovulation is delayed or it is not there. Secondly, we also find a lot of luteal problems with thyroid. So once if the patient conceives, then there is also problem in carrying the pregnancy, and there is a high chance of miscarriage. So hence, thyroid, for all practical purposes and for all fertility reasons, the thyroid stimulating hormone, or the TSH, which we commonly look at, should be in the range of 2.5 to 3, which normally is in the mid range of the normal value of TSH. So that is why it is important that we maintain it around that level, and so that our conception becomes spontaneous and easy. So per se, sometimes thyroid does not cause a lot of, many a times we find that the lady is pregnant and we find her thyroid stimulating hormone very high. So not in all cases do we find that thyroid is causing a problem in conception. But in patients whom we find that they are not conceiving and we incidentally find that the thyroid is abnormal, then definitely it needs correction.
Right. So we can say that diagnose or investigation is really important when you
Yes.
are planning your family.
Yes.
Dr. Gunjan, we just touched upon female factor on 35, and what about the male factors? मेल की शायद हम एज के साथ बात नहीं करते, but why so?
Well, the very importance lies that only one egg in a cycle is required for a female, but there are millions of sperms which are released by the male in one uh, act of contact. So, hence, you can see the importance of the female gamete, right? So, because primarily the male gamete are so many in number, hence, and it's physiologically that the male fertility does not decline with age, that we find that the male factor is not that relevant with respect to age, but definitely there are other factors in the semen which can cause infertility. So they may be, the count may be less, or the motility is less, or maybe the morphology is less. Sometimes we also find that the DNA fragmentation is more, leading to non-conception. So there are other parameters apart from age which can affect, which can cause male infertility and affect conception.
But definitely age,
Yes,
we can
is
say,
not a
is
factor.
not a factor in male
Yes.
when we are discussing about male infertility. Right. डॉक्टर गुंजन, आपने बहुत सारे कपल्स, बहुत सारे फीमेल्स को ट्रीट किया है, तो कुछ ऐसा केस या द केस वन, द वन विच रियली टच्ड यू, एंड आपने एज अ डॉक्टर उसको बहुत अच्छे तरीके से देखा, समझा, एंड विद कॉम्प्लिकेशंस, एंड दैट टू एट हायर एज. So we really want you to discuss one such case or case study with our viewers so that they can have this positive attitude कि yes, मैं भी कर सकती हूँ.
Okay, so I would not like to reveal the patient, of course, because I have
Right.
to maintain the confidentiality. But definitely one of the very I would say one of the cases which is really close to me is, this is a young 28-year-old female. They've been married just for 6 months, and they came for fertility consultation. So in fact, on the first visit, I was a little alarmed, and I said, well, it's been just 6 months since you've been married, so this is not really the time when I should be investigating. But then she slowly revealed to me that she had an AMH which was like 0.28 nanogram per ml, which is way low than what is expected for her age group. And on asking her history, I also came to know that her sister is also having infertility issues. So, anyways, having that background, I got her AMH and other tests done. Her AMH again came out to be of the similar range of zero point 0.2 and zero point 0.3. And on her second day of periods, I did a ultrasound and I just found 3 antral follicles in both the ovaries. I was a little disturbed. I got her karyotype and the genetic testing done. There was no factor. The male factor was fine. There was no other test which was abnormal. I counseled her that we would go in for an IVF, and maybe we might get a result or we may not. Definitely, I did talk about donor eggs, which of course they were not willing to go in for because they were very young and they had just been married. So they wanted to give it a try. And so we took her, I stimulated her for IVF. We gave her some additional supplements and some combination of gonadotropins. She just barely made 2 eggs. So I retrieved it and I got 2 embryos. One was a good embryo and the second one was not that good. We did a transfer on the second day, day 2 transfer, and by God's grace, it was really nice. Her UPT came positive, and after 9 months, she delivered a healthy female. So I was very happy for her. It was a good 2.8 kilo baby, and it was just like couldn't have imagined. And after 5 or 6 months of the delivery, she comes again that I have missed my period, and I was a little surprised because having known her history, I thought that maybe pregnancy is natural conception is not possible. But by again the Almighty's blessings, she conceived on her own. And this time again, she delivered and she had a very normal pregnancy and she delivered a spontaneous conception and a normal, healthy baby by cesarean section. And on cesarean section, I found that her ovaries were really very small. And it was just it was something very divine that she conceived on her own, and for her to have one baby with IVF was also a miracle. So that is one patient I always keep very close to my heart, and I feel very good that science has evolved that it can give happiness to so many couples. So yeah, that
Right.
was yeah.
सो व्यूअर्स, इट्स नॉट दैट कि आपका एएमएच लो हो गया है तो टेंशन स्ट्रेस शुरू कीजिए। नहीं, उस टाइम पे जस्ट स्टार्ट सिलेक्टिंग द राइट डॉक्टर फॉर योर ट्रीटमेंट। इधर उधर जाने के लिए या ये सोच के कर लेते हैं ऐसे करने से कुछ हो जाएगा, उस सब में we believe कि please don't waste your time, select the right doctor at right time so that you can have the right pregnancy. As Dr. Gunjan just mentioned कि बहुत सारी चीज़ें, बहुत सारे फैक्टर्स हैं, ज़रूरी नहीं है कि with progressing age your AMH is declining. It's possible that in late 20s also you can face such issues, but don't worry, science advanced है, डॉक्टर्स हैं आपके पास, तो ज़रूर डॉक्टर्स की विजिट का, डॉक्टर के आपके पास होने का फ़ायदा उठाइए। डॉक्टर गुंजन, अगर आपके पास कोई पेशेंट 35 के आसपास आता है तो व्हाट ऑल टेस्ट यू एडवाइज देम इन फर्स्ट गो?
Okay, so after taking a detailed history, we normally, on the second day of her periods, we do an ultrasound and we do the basic fertility tests, which is the FSH, LH, estradiol, progesterone, prolactin, and thyroid levels. So these are going to generally tell us about her basic fertility status, and the antral follicle counts we assess on the ultrasound. Similarly, if she's a married woman, we advise the husband also to have a test, a semen analysis test, by having a 2 or 3 days of abstinence period. Now, if we are looking at if all the parameters are all right, then we normally, if the patient is married for more than 6 months or has had previous treatments, we would like to do a tubal patency test, which is also called a hysterosalpingography test. So all these tests are basically going to tell us what is the fertility status of the couple, and do we need to give this couple some additional help. Simultaneously, we also start with some prenatal vitamins like folic acid, some vitamin D3, and also multivitamins which have zinc and vitamin C and vitamin E combinations, so as to enhance fertility. So based on the results of our test, we add on other medication if need be. And apart, if she is beyond 35, we also have to know her general health status. So we also like to do her complete blood count, which tells us about her hemoglobin. We like to do the sugars. We also like to do their thalassemia status. And of course, if there is a family history of diabetes, her HbA1c as well. So these are some of the tests which are going to tell her about her basic fitness. And then we proceed forward with what we have planned for the couple.
Right. Dr. Gunjan, usually with low AMH, one very important, we can say that procedure is being done by the doctors is embryo pooling. So, what is your take on this embryo pooling?
Yes, definitely embryo pooling is required, because sometimes we find that, again, as I would again like to say, it is the number of eggs which will define the possibility of us having one normal egg. Okay, so if
Right.
the number of eggs is less, which we get on stimulation, a person with a low AMH, if she and a low antral follicle count, will definitely give us less eggs on IVF stimulation. So in those cases, to increase the chances of her getting pregnant, we would like to have as many eggs as possible and make them into embryos. So as we know that in young girls, there is no parameter or no guide which can tell us that how fast the AMH is decreasing. So if
Right.
a young girl comes to us with a low AMH, our purpose is to retrieve or to procure as many eggs as we can before she depletes, her ovaries are totally depleted of egg. So in these cases, we advise the person, the lady, to undergo multiple cycles of IVF so that we can have as many eggs and we make embryos and keep them as a backup. And then once we are done with having many embryos, then we start doing the transfers, so that the possibility of pregnancy is much higher than if we have just maybe one or two embryos which we have for her.
Right. So, Gunjan, how many cycles of stimulation you suggest, or like maximum how many cycles of stimulation we can have if we are opting for this embryo pooling?
Well, again, it depends, Purnima, that how many eggs are we getting in one cycle. So normally we find that if the protocol if we have applied, sometimes we have just one egg a woman is producing. So if she has a very low AMH and she's having one egg, so maybe 3 or 4, 5 cycles of IVF of minimal stimulation we might be doing. But if there is a patient who has given us 5 eggs in one cycle, and in the second cycle we have another 5 eggs, so that's enough for her. So basically we have to individualize the case. So the purpose is to get as many eggs as possible, and the younger the patient, the number can be less, but the older the patient, definitely we would like to have more number of eggs. So that
Right.
is the thing which we would like to
Uh, Dr. Gunjan?
yeah,
Yes.
sorry. Yeah.
So we can say that yes, as many as 3 cycles of
Minimum.
stimulation the lady can do.
Yes.
अच्छा डॉक्टर गुंजन, एक और बात है, लोग कहते हैं जितना आईवीएफ करवाएंगे, जितना स्टिमुलेशन में जाएंगे, हमारे एग्स, हमारी ओवरीज खत्म होती चली जाएंगी। क्या सच में ऐसा है?
नहीं, ऐसा नहीं होता है। ऐसा है कि हर साइकिल में जो, अगर आप नॉर्मल फिजियोलॉजी भी देखें, तो नॉर्मली एक एग हर साइकिल में मेच्योर होता है, पर उसके साथ 15-20 एग्स जो हैं वो साथ में बढ़ने शुरू होते हैं, और धीरे धीरे करके वो ऑटोमेटिकली अपने आप डिस्ट्रॉय होते रहते हैं, और उसमें से, उस पूल में से एक एग जो है हमारा मेच्योर हो जाता है। ठीक है। सो अब आईवीएफ के जरिए हम ये क्या कोशिश कर रहे हैं कि ये जो 15-20 इकट्ठे बढ़ने शुरू हुए, इन सबको हम डिस्ट्रक्शन से बचा के और इन सबको हम मेच्योर कर लें. So definitely there is a hidden pool which is always there. So it is not like that we are exhausting the or depleting the ovaries. It is just that we are trying to retrieve the ones which are there is a possibility of destruction. So that is why this concept that the ovaries will be totally depleted is not there, not relevant.
Right. So we can say it's a kind of myth that doctor is doing something with your ovaries. Rather, doctor is extracting the egg so that it could be used in coming cycles. Dr. Gunjan, what could be the reason of drastic fall in AMH? Because we have seen many cases where people said कि अभी 2 महीने पहले तो करवाया था, AMH इतना था और 2 महीने में इतना ज़्यादा. What could be the reason for this fall?
देखिए, सबसे पहले तो हमें लैब वेरिएशन भी बतानी पड़ती है. समटाइम्स व्हेन इट इज डन, दैट इज आल्सो हैज टू बी सीन. Normally if we do it on the second, third day of the cycle, that is the time when whatever is the AMH will be the ideal one. If we do it in the latter half of the menstrual cycle, then definitely the AMH will be less. Secondly, we also have to see factors. Was the very reason why AMH is falling is not known. It could be things like environmental pollution, it could be radiation, it could be pesticides, it could be many other factors, which smoking is another important factor. Then there could be some chemical agents, then use of plastics. All these things, gradually people are kind of discovering that they may be causes for low AMH, but exactly it is difficult to pinpoint that why AMH is decreasing. Women who've had surgeries, ovarian surgeries or pelvic infections, they also tend to have lower AMH. So this is exactly to say why AMH is decreasing is not possible, unless definitely infection is the cause or there is a cause like surgical intervention has been done. But definitely what is important is that if we find that the AMH is low, we should not sit over and think that there are means that we can increase it. Then we should act on it. So that is more relevant than finding the cause for decrease in AMH. And definitely the lifestyle which these days people are following, that also has a reason why the fertility is declining. So these things have to be corrected, and then diet has to be corrected, and less of junk and processed food should be taken. So these things may have a cause in decreasing the AMH.
And Dr. Gunjan, how frequent you suggest a lady to go for these important tests? Like once in a month, twice,
No, that
after
is not.
2 months, or like this?
No. See, what is important is that if a woman is married and if she's less than 35, so up to 1 year, we can think of, they can try naturally and maybe they've done the test once and that's fine. But beyond 35, if she's married for 6 months and has not yet conceived, then of course she should be going in for all the investigations. But for a younger couple, definitely till 1 year we should not raise, kind of be alarmed about things, unless of course there is a family history of infertility or she has had some surgeries or there is some chronic infection, or sometimes the patients even get themselves checked because they've heard from their friends that somebody is having difficulty in conceiving, and so that is a different scenario. But actually we should not be investigating in a young couple when they are married for within 1 year. So let them try naturally for a year, and then we talk about investigation. Similarly, when she's older than 35, then less than 6 months, we should not. We should let them have a natural conception. Beyond 6 months, yes, of course, we should not delay further.
Right. So we can say, yeah, yes, your age is really important, because as we are aging, our ovaries are just aging with us. ऐसा नहीं है कि हमारी एज बढ़ रही है और ओवरीज की नहीं. रिप्रोडक्टिव सिस्टम आपके साथ ही बढ़ रहा है. So please take a note. If you are not interested in starting your family right away, then please do visit fertility center. Not for conception, just for seeking the help, which we discussed, the freezing process. It is really helping, and many of common people are also opting for this. It is just to summarize your fertility journey. It's not that कि आप बाद में pregnant हो ही नहीं पाएंगे. Just talk to your doctor, visit your specialist, and just see how the specialist would be able to help you in this journey. So we can say that yes, conception is possible after 35, and again, freezing is a very good option for you. So thank you, Dr. Gunjan. Thank you so much for joining today, and definitely it will help many of our viewers to decide कि freezing पे जाना है कि नहीं जाना है. 35 के बाद conception को कितनी जल्दी सोचना है या नहीं सोचना है. So thank you again, Doctor, for joining. Thank you.
Thank you so much. Thank you.